You're having numbness and tingling in your hands. What is going on? What gives? What's happening here? Let's go in depth on that a little bit today and try to clear up some confusion on why you might be having numbness and tingling in your hand. Typically, it's one of two nerves. It's either your median nerve or your ulnar nerve. Obviously, it could be your radial nerve, but typically it's going to be your median or your ulnar. That's based off seeing thousands of hand patients. Typically, those are the two common culprits for most people. Now, obviously, there's exceptions, but let's not go there yet. So, try to pinpoint where your numbness and tingling is. When I ask my patients, where's your numbness and tingling, a lot of them are like, oh, just my whole hand. I don't know. My hand's just numb and tingling. I'm like, well, try to be more specific and let's try to see if we can pinpoint which nerve it is. So then maybe we can find a treatment once we figure out which nerve it is. Your median nerve is typically innervating your index finger, middle finger, and the radial half of your ring finger, and also the thumb. So you might have some numbness and tingling in the base of the thumb, index finger, middle finger, or that side of the ring finger. Maybe not perfectly, there is some variation, but yeah, in general, that's median nerve. That would be probably carpal tunnel. You've probably heard of that. Then let's go to the ulnar nerve. Ulnar nerve innervates the pinky and the other side of the ring finger. Super common. You got numbness and tingling in the ring finger and pinky finger. So your nerves are bigger than you might expect. If you're not like an anatomy nerd type person that's studied this before, you might think nerves are like teeny tiny little microscopic things. In reality, if you cut your arm open, there's like little extension cords in your arms. They start in your neck, they travel through your brachial plexus, they are your brachial plexus, they travel down your arm, split into three: median, ulnar, and radial nerves. There's other little sensory branches, but those are the big three. So those little extension cords are conducting electrical impulses from your brain to your muscles. They give you your proprioception, the awareness of your hand in space, your coordination. They cause you to be strong or not strong. Sometimes your muscles might be atrophied, that kind of thing. Or they do temperature regulation. Maybe your fingers get cold, maybe they get hot, that kind of thing. They can cause shooting pains, burning pains, electrical pains, all kinds of pains. You don't have to have all those symptoms, but you may have some of them. So, what would my advice be starting out to you if you have numbness and tingling? Well, if you've had it for a significant period of time, the first thing I would recommend you do is go get an EMG study done. Make sure you know exactly what is going on. Otherwise, you're just guessing. Go to your doctor, get an EMG study done. Go to an ortho clinic, somewhere that does orthopedics probably. Get your EMG study done. So they're going to tell you where exactly along your nerve there's a compression site. And wherever it's compressed, whether it be the cubital tunnel at the elbow or the carpal tunnel at the wrist or somewhere else or the neck or whatever, they can tell you how bad it is, if surgery is required to fix it or not. That would be step number one, people. Don't ignore it. Some people make the mistake of they've got the numbness and tingling, so they're just going to ignore it and they're going to live with it for 10 years. And then by the time it gets so bad, they do finally go get it checked out. Then sometimes it's too late and the symptoms are just there permanently at that point sometimes. Maybe the muscle atrophy is so severe that their strength never comes back. Maybe their coordination never comes back, that kind of thing. So don't push it under the rug. I hope that this video, if you're having numbness and tingling, inspires you to go get an EMG study done or to do further exploration on that. But that's just some basic general info about what may be going on. Try to figure out if it's your median nerve, your ulnar nerve, your radial nerve. Pay attention to when it happens, how often it happens, that kind of thing. Rule number one of nerve pain and recovering from nerve pain is do not recreate your symptoms. If whatever you're doing is causing more numbness, more tingling, stop immediately whatever you're doing. In general, that's going to be things like a lot of vibration, power tools, excessive wrist flexion, extension, excessive elbow flexion, extension. Because remember, those nerves are like extension cords. They have to have physical space. So if you're sleeping at night and you bend your elbow beyond 90 degrees, that ulnar nerve has less space to travel back and forth. which can cause you to wake up in the middle of the night with numbness and tingling in the ring finger and pinky finger. And if you're doing that every night, I don't care what exercise you do, what surgery you get, you're still probably going to have nerve problems if you're sleeping in poor positions for hours and hours a day. If you're someone who sleeps with your elbow bent up like this, put a pillow in your elbow crease, lightly wrap it just to force your arm to stay a little straighter. Okay? It don't have to be gun barrel straight, but it needs to be at 90 degrees or below. Same thing with the wrist, obviously common sense. There's a reason why carpal tunnel braces have been around forever. It keeps you out of excessive wrist flexion or extension. Holds your wrist fairly straight. That reduces the stress on the median nerve. There are also all kinds of nerve gliding exercises, flossing exercises. That's for another video. This is just the basics of what could be going on. You, unfortunately, if you're having numbness and tingling, it's a complicated problem that is a little bit unpredictable. You know, it's your nerves are electricity. They're conducting electricity. That's kind of unpredictable in nature there. So that's why I'm saying you need to get a diagnosis, figure out exactly what's going on. That's what you got to do first. Okay? Have a good day.